everyone, this is Dr. Marcus here at Alvarado Healthcare. Today I wanted to present a video on a question that I've been getting very often here in the office. A lot of patients asking about supplements. Which ones to take, which ones are worth buying, which ones aren't. You go to your physician often and they say, you're low on vitamin D, vitamin C, vitamin B12, and you need to supplement that. And then you go to the store and you find yourself, whether it be Walmart or the health food store, and there's a variety of different options there, and it's just overwhelming to make a selection. And are you making the right selection? You have some supplements that provide a lot of value and nutritious benefit that are biodigestible. Then you have some others that provide maybe minimal to no value at all, and those are the ones we want to watch out for. So we're going to cover that in today's video. The supplements that we're going to be covering are vitamin D, vitamin B12, vitamin C, calcium, and coenzyme Q10. I will add that these are supplements. So a supplement is exactly that. It is a supplement to a normal diet. There's nothing to replace a good, healthy diet, which can fix so many problems that we're discovering now. There's no supplement for a good, healthy diet. So that being said, we'll go ahead and jump in. Vitamin D, some sources of vitamin D, good sources are fish, eggs, and dairy products. Now, I do recommend that you not consume too much dairy because that can cause a lot of digestive problems. So that should be taken minimally. So I would definitely recommend more fish or eggs to get that vitamin D. In addition, as many people know, you can stimulate your own production of vitamin D by getting about 10 to 15 minutes of sun exposure each day. So what are the active forms? Active forms, or the form that you want to have in your body, is cholecalciferol. Okay, so this is vitamin D3, and this is the one that's most used in our bodies, okay? So vitamin D, the benefits, just to touch on a few, would be diabetes, flu, and cardiovascular diseases. So there's strong evidence to support that those three things, among many others, vitamin D can be beneficial for. Now, how do you know if you might need vitamin D supplementation? That's where you might be feeling the muscle aches or weakness or some twitching, maybe some lightheadedness, and then also depression. There's a reason that people in the winter time tend to be a little bit more depressed. When that sun isn't out as much, you don't get as much sun exposure, you have a little bit less vitamin D. Okay? So next, vitamin B, and specifically we're talking about B12. There's numerous B vitamins out there. Today we're focusing on B12. So B12, good sources of B12 would include beef, fowl, fish, clams, and animal organs. Oh yeah, a lot of vitamin B in those animal organs. It's stored in the liver as well as muscle tissue, so those are where you're going to find that vitamin B. The active forms, so these are the forms, again, that you would want to look on the back and see that these are present there. That would be methylcobalamin, cyanocobalamin, and hydroxycobalamin. I personally like methylcobalamin. I take it daily with my athletic greens. I find that really breaks down well in the body, and I really feel that burst of energy, that increased focus when I take that. We'll find the others in supplements. I just prefer that one. Benefits: brain health, energy, and increased focus. Numerous benefits of B12. Those are kind of the three ones I wanted to mention. And then deficiency symptoms. How do I know if I'm deficient? So if you feel tired, lethargy, depression, or poor memory, those can be indicative of a vitamin B deficiency. Okay? All right, next, vitamin C. Vitamin C. We're going to find that highly in kiwi, citrus fruits, apples, juices, and peppers. Okay, that's vitamin C. Active forms, you're going to look for ascorbic acid or ascorbate. That would be on the back of a supplement if you were looking for vitamin C. Benefits of vitamin C, there's tons of them. Anti-inflammatory and blood vessel health is one, and then help with immunity. Now, a lot of talk is out there about decreasing your potential of getting the flu. Research really supports that it may not decrease your likelihood of getting the flu, but when you do have the flu, if you do supplement vitamin C, you can decrease the duration, and that can range anywhere from 8 to 14%. So that's definitely something worth knowing there. And deficiency symptoms, not too many people are deficient in vitamin C. Most people know of is scurvy and pirates out at sea getting scurvy. I'm going to put a picture here. something piratey or scurvy-like, maybe a little gross, and there's your scurvy. All right. Next is calcium. So calcium, is one that we know for bone health, joint health. The sources of calcium are cheese, orange juice, salmon, and leafy greens. I do recommend again, back to the dairy, keeping your milk, your yogurt at a minimal. Focus more on orange juice, salmon, leafy greens for your calcium supplementation naturally. The active forms, this is one that a lot of people, when they go to the store and they get that calcium, a lot of people tend to get that calcium carbonate. That is the same as kind of sand and seashells. It doesn't really digest well in the body, so that's why I recommend more calcium phosphate, calcium citrate, calcium lactate, or calcium malate. One of those four are going to digest a little bit better for you. It differs from person to person, but those four get a little bit more bang for your buck than you would with calcium carbonate. All right, and then as I mentioned before, the benefits include bone health, joint health, strong evidence to support preeclampsia, so that would be for pregnant women. Calcium supplementation can be very beneficial for that. Deficiency, numbness in the fingers you might experience, muscle cramping, lethargy, decreased appetite, and arrhythmias of the heart, irregular heartbeat. And lastly, Coenzyme Q10. I love Coenzyme Q10. It has numerous benefits. I give a free bottle of that to any of my patients who are complaining of muscle cramps. So if you are a patient, you get a free bottle of that. I know it's beneficial, so I just trying to help as best I can. Sources for Coenzyme Q10, our body makes it naturally within the mitochondria. So minimally you will find it in food. There is some in meat, fish, avocados, and other things, but supplementation really can be significantly more beneficial than the dietary supplementation there. So active forms of Coenzyme Q10. So you're going to look for ubiquinone or ubiquinol. So benefits for Coenzyme Q10, lots of evidence to support fibromyalgia, heart disease or heart issues, migraines, and then anybody taking statins or cholesterol medications like Lipitor. It breaks down or inhibits the energy in the muscles. Your muscles are robbed of the energy when you're taking statins. I do recommend always, if you're taking statins, to take Coenzyme Q10. Symptoms, muscle weakness, cramps, and visual impairment if you do have a decrease in Coenzyme Q10. Okay? I hope that's helpful. I'm going to put some links to some of the websites that I would go to if I were looking to purchase some supplements. If there's anything else I can do to help, please don't hesitate to contact us. We're always trying to help here at Alvarado Healthcare. So I hope you got some value from this video. Please comment, share. Other people could benefit from this information, I'm sure, because I get numerous patients asking me these questions. So I hope this was helpful. Thank you so much for listening. Have an awesome day.
Get on your bikes, ride!